Agilosart actions and precautions for use. Agilosart is a medication classified as an angiotensin II receptor blocker ARB, commonly used to treat high blood pressure, hypertension and reduce the risk of cardiovascular disease in patients with left ventricular hypertrophy. It is also prescribed to protect the kidneys of type 2 diabetic PAT. How Agilosart works. Treating high blood pressure. Agilosart effectively lowers blood pressure by blocking the action of angiotensin II, a potent hormone that constricts blood vessels. This blockage allows the blood vessels to relax, reducing pressure on the heart and improving blood flow. How Agilosart works. Reducing cardiovascular risk for patients with left ventricular hypertrophy, a condition where the heart muscle thickens. Agilosart helps minimize the risk of cardiovascular diseases. It achieves this by dilating blood vessels, reducing the workload on the heart, and protecting the heart muscle. How Agilosart works. Protecting kidneys in type 2 diabetes. Agilosart safeguards the kidneys of type 2 diabetic patients with proteinuria by reducing pressure on the kidneys and minimizing kidney damage. Dosage and administration. The appropriate dosage and administration of Agilosart are determined by your doctor based on your individual health condition and response to the medication. Dosage and administration. Hypertension. The typical starting dose is 50 mg, taken once daily. This may be increased to 100 mg once daily, depending on your blood pressure response. Dosage and administration. Cardiovascular risk reduction. The usual starting dose is 50 mg, taken once daily. The dose can be raised to 100 mg once daily based on your blood pressure response. Dosage and administration. Kidney protection. In type 2 diabetes, the typical starting dose is 50 mg, taken once daily. The dose can be increased to 100 mg once daily based on your blood pressure response. Combinations with other medications. Agilosart can be used in conjunction with other blood pressure lowering medications like diuretics, calcium channel blockers, alpha or beta blockers. Your doctor will determine the most appropriate combination for your needs. Potential side effects of Agilosart. Common side effects: dizziness, lightheadedness, low blood sugar, hypoglycemia, low blood pressure, hypertension. Less common side effects: elevated potassium levels, hyperkalemia, nausea, vomiting, diarrhea, constipation, abdominal pain, cough, shortness of breath. Potential side effects of Agilosart. Rare side effects: rash, itching, angioedema, swelling of the face, lips, tongue, or throat, hepatitis, liver inflammation, liver failure. Important precautions: hyperkalemia, elevated potassium. Agilosart can increase potassium levels in the blood. Regular monitoring of your potassium levels is essential, and you should promptly report any unusual symptoms to your doctor. Important precautions: hypertension, low blood pressure. Agilosart can lower blood pressure, particularly when starting the medication. Be cautious when standing up after sitting or lying down. Pregnancy. Agilosart is not recommended for use during pregnancy. Important precautions: breastfeeding. Agilosart can pass into breast milk. Consult your doctor before using this medication if you are breastfeeding. Allergies. If you have a history of allergies to any ingredient in Agilosart, avoid using the medication. Inform your doctor if you have a history of allergies to any component of Agilosart. If you have a history of kidney disease, liver disease, or cardiovascular disease. If you are pregnant or breastfeeding. If you are currently taking any other medications, including over-the-counter drugs. Inform your doctor. Note: this information is for general knowledge and does not substitute for professional medical advice. Consult your doctor before using Agilosart. Your doctor can provide personalized guidance based on your unique health situation.